Talvez se sola malungil ko singen mergi dero ko itian moren sunya superstation WWFM kada lutal me ko tera mlitiul le la sit singen tiul ko singil on tiul buila sola ko la di 2 more days away from September 11. Anyway, malungil ko singen sola me pok pesquisa que technical information que na make a few adjustment tra tial broadcaster gid live remotely live mangotiag da teletel el ang callback el dengwar git 488-4848 el ase ang ramos el low ringing murang la radio mtimoti ateng spulue mergoya direct tara akire del momtang li delang vampian lamo la testa igir rogui esola el atia live as we are talking, the whole world is watching and listening mangkom imo aware ngi lo ase tial angaramo nga kimle recorder ngi or top ngi ra Facebook rate or 2 days later I mean taiga gidele YouTube ndi elandia live bulgula amra se sel dongo do ngi atop dra blulat torren singa bek ngi ra nga tel blulat direct close civil time in live ra MBTV ra channel 26 direct live ra radio WWFM ra 88.5 ma 89.5 direct live ra Eco Paradise tagi joint broadcaster tagi the program ra updating ra buai lo ya ka EOC ma Ministry of Health and Human Services otherwise so live malungil ko singel mergi rogi kultur ke mo Michael ngumsang kafar bolo omu ra program digi dera ko singel kafar
Talway sa kamal sulang tulig malungil ko singin morgaw rada maradias broadcasting. Idirek kaling utyate alle obangge meman meringa sulir adra ngarel belaw lo bangget selbek temela talk show joint broadcast.
I see.
Aldi meringa suli we malu kera bekla no sabir el me join gid el algasus. Meringa raungil ko singin marabekla. Tulig ay mal merungud lo ay sila set tokar guest gid el algasus.
Okay.
Dr. Thane Hancock, Dr. Haley Cash, thank you once again for joining us this week. The third talk show for you guys to join us. So we thank you. I think this is the last talk show, but certainly if you do ever come back, hopefully when the pandemic is over for other things, we can get you back on the air and join us for other topics. But the tegi de amo mongora lobong le tulig lobong treat tegat terut tokta magdamal meringa sulil tamlamo edel Sunday lobong get magdamal merungu de meringa sulil eng tamle deploy mail gidel dimle erul Sunday and apple by lo subi el extend magda meringa sulil mutal tara Sunday subilo lo subi lobong get me obong get la talk show. Sisi time perang udalo ay sila sa ngatiang ukurdeo Dr. Patrick Talay do tang lilbekla del pong president tara Palau Community College hindi o sisi time member sel National Emergency Committee NEC.
Okay.
Nga sulen nga ruba kan sa BL me bangedel algosus direct lo bangela Mr. Olgaril Kazuo direct member NEC nga do tang lil nga EOC ra COVID-19 response mga meringa sulit dirigat teru ruba. Of course, as always, Obangere Algasus, Incident Commander EOC, Liter Udoy, Madirek PIO Chief Adol Migardeu. Toksher gide tuligal Algasus, as always, Akdomo sa telela Incident Commander, maskita updates, rakuk telela real namkatbok since last week, talk show gid and then nakada mastira te alert tirgat teruruba kamatuguk mo o maklat kargid.
Okay.
Maklat kargid raigel gukora atlet tele laurior togunigel tokora omarain meso isur belaw sa edel gora kayong seo radlong lete e tokar ada te tuligel may kita mending sa tingani ada sta turist el mendi akumda sa omasindra adal mayor atadel marangaligetel el me olding el marmerar wa alsang mga rakken mong malungil kuk teal da kay nga sel bekla al kapkat kra kuk aigel luudre la time ra tokorar wa a restriction of movement ma aigel rokuil kita ulingitra a travelers el mesois mato toltirakla mang moy say that tetele la talk show etuli ka kaptel mlakmu igel technical aspects mal sugo mga niya callers en mal sebedel silmi mo klom kodol le korga okay re kita malasum longe regel el questions di.
Okay.
Alwaysek mun masa TL masa incident commander mbolo mura program lobang o basa igil updates.
Okay. Sila ang kapar.
Wilgab sanget tulir. Magdomo el smoda tristigal ungay gelem legay sergil sadara last week tesegil Tirgay del Peru ngamla mo ngilem la test la tobadra isolation hindi nga rin gay del imo ng lumade el close contact ang gadir ka malamol Michael Calcel el mangara isolation facility Sunday nga mo mga true club seringi mga damo o tester ngi yal sumang negative ang total mora ablu adra surveillance malamol mal chekaringi rabe Calcel alam ko dong ngi yang kora dia ka symptoms ngi malmasisi makadati mengiler segi del Sunday el mutel motes ngi.
Okay.
Selugok tungura umrus ayegi del up to last week la September 4 last del umrus sa segi del Sabadong kadang la ura trigel fully vaccinated amlam yaklel mo 15,647
I see.
ngara 80 talgibel talgibel kra 89% tra total population and diesel wukay gel kora kumakay so delay gel na lour Trigel adults Trigel 18 Akril Morbaba 14,872 amlam Michael first dose tir.
Okay.
14,560 amlam Michael second dose. Ang bukor dali del dartal aga virgagiril me Malaya igel second dose tir Trigel 18 Akril Morbaba. Trigal buk magigaril ngal ka 1,269 amlam ma first dose tir. 1,087 amlam ma second dose.
Okay.
Taygidal almost ngara erul darta amate algiril memberus aygidal umrus aygidal blada announce la sigil wasay ngaringi September 17 ma September 24.
Okay.
September 17 ngaring trigidal Pfizer matamira ang erul dose ya September 24 ngaringar memela second dose tira Moderna ma Pfizer.
I see.
Ma aygidal mo moda kaygelo urea agigidal adult fully vaccinated 14,560 again adolescent 1,087 mo 15,647
Mas rite at mula sila mula ringi litiam kam kaskali mga bitangan mundiak mula ringi ang kami ngaran advice o mas kama other belaw namo klo adaktra rang mamul malat tiang litakaw titakang tigar expert magay titakang legi yakada betul ke elang kita fauci el abdullah se gagir el fire ma el ngarbabel adel kongres le ngarak la World Health Organization ma CDC pas kama ko advice po mo klarang mam
ang waise tulik kada dira kalma diorni trara bulu ulita kaloreng mutakang mal dioreng sa yel to el tudra Ministry of Health and Human Services kama dira kal ngara EOC dira kal dian magidira kal ngara wa Facebook dira kalomesa patokal tokoel medum diga ma dira kal mal diul tu ila ra ayayid el qura advice maluben guidance lo maskida WHO ma CDC mga gidira kalmal mga lirar adra blula sila kamatakte may mga oros ay gid talm lang 15,000 adra vela amlam rus dirka kada betigan ni maringi akora amlam kasak raigar orus el mal mo koras me el mo erura ko dal mal ubet tamla madra ay galorus el bladangay
man saber mo luasya to mo reng sir kami ule kami amla ay gel official malupen scientific facts from CDC and kimo reng sir kami di dato reng sa Facebook may gal social media
way set tuliga ulma gidira kalmal mol may gidel talk show gidra abe kalsande amalong maral wasay ngira del me otobdaro fu el information el moral adra blu matamdenge so ngora open line la communication gid mar adra blu al direct kalmo ulang sedro qara manglo arandir ang kau kaga farangar nga ngot alwas ml edaringi anding segi dagi mal qara diolingi tra klaing seura adra blu ma kaloreng yawasay medaw takangal malmol malmrula yidel el tokoy bla imamade qad malgol mer ilang ay gidel wal preventive measures alwasing ngaranga sa edel mrula qad al masaba aql gidel galbo da ser tagidel raqt
okay halle ka fare adeng war kita 488-4848 masugo mga nyangidil adra blu loreng sa mesetial program please kola 488-4848 desay lang ang most of ela ka farm tirgel arwat after hen ka makas tirgel el adatial MHHS el most will answer instead radia sel tabrang ngel blu ang relu ko mo ke rigi de mas kami asabam mas kami wrong information or assumption mategi da te allen mo ke tirgagi tira brut euro lo inform rigi da gir ro ko telang tingil tegi del COVID-19 ma-update sir ngip. So please send ko na 488-4848 asu mga niya karamiw. Back to you, Kaspar.
So lang itulig direct ronda sa sekalebay lungil do buktoger Dr. Tain since ngay adra CDC ngartelo bangeder lam te alal loger tegi del gel morngi I'm sure na sabel director ko ra maskida ko ra bebir information الجديد.
Okay.
So Dr. Stein, the question is, there's so many news out there about this the third dose and the booster shot. There's confusion about whether or not we should even get it at this point. There seems to be it's not clear when the timeline is, if we're ever going to get the third dose or the booster shot. So the question is, what can we get? What can we get from that? Who should we listen to, and what advice should we take at this moment?
Yeah, thanks. And did you guys discuss the difference between the additional dose and the booster dose? Do you think that's important to you?
No, we haven't.
Okay, Dr. Hancock, the problem is we don't know who to listen to, because the social media right now, the Congress of the United States, the CDC, they're singing different songs, and we're confused, and they want to fire Dr. Fauci, so who is to listen to?
Yeah, no, it's an excellent question. And so in regards to the booster dose, really who you want to listen to and wait to hear from is FDA and CDC's Advisory Committee for Immunization Practices, or ACIP. And they are the individuals that are really, the two groups that are really looking at the safety and efficacy, or how well it works, these boosters work. And so it is sort of confusing. It's sort of unusual that a lot of the leadership said, hey, expect boosters would be rolled out, and I think part of that was really to allow jurisdictions, states, and even Palau to start preparing for potential boosters. It takes some effort to spin up those vaccination places and that sort of thing. But really what we want to wait for and what people should look for is the information coming out of FDA and CDC's ACIP. And so going to cdc.gov is going to allow you to get the information after those committees meet. Right now, FDA is reviewing all the information that's been submitted to them to really see if a booster is needed and is safe. And there's a lot of rumors back and forth saying, yeah, it looks like potentially there's maybe a booster for Pfizer, and maybe we'll see what happens with Moderna, but that's all guesses until FDA and CDC's ACIP meet and provide that information. And it looks like it's going to be probably around the week of September 20th that they have those sort of final meetings where you'll start being able to find out the accurate information on what will happen. So, yeah, apologies. It is confusing. There's a lot of uncertainty, but just hold tight, wait, know that your Ministry of Health and Human Services is preparing in case boosters are needed, that they're ready to be able to roll that out quickly for your community if indicated, but really want to fall back on the science to make sure whatever is done for Palau is safe and effective.
Okay, thank you, sir.
And then maybe talk about the messaging from WHO as well, why they're not advising for a third shot or a booster at the moment. Is it because of the actual vaccines, or is it because they feel like not enough people have even gotten the first dose, and then now some countries or some jurisdictions are looking for a booster shot? So is that their main message, or is there something different that WHO might be putting out?
Yeah, I think WHO is looking across the whole world, and whether it's globally, you live in a country elsewhere, or if you're living in Palau, really the most important vaccination to get is the first and second doses, right? We really want, that's the one that provides you the most coverage against the virus that causes COVID-19 and Delta variant. And so that's an important message to people out in Palau who are not yet vaccinated. Hey, you still have time. It's not too late. If COVID is really spreading around and it infects you, it's too late. And we don't know. I mean, you've seen that there were the 2 cases here. Fortunately, we haven't identified others, but this is a sneaky virus, and you should get vaccinated now if you're not vaccinated. If you've only had 1 dose, you really need to get that second dose. That second dose is way more important than any booster, because we're finding that really helps protect you against the Delta variant. So when WHO brings up, hey, maybe we shouldn't use boosters, they are thinking about those individuals that are not yet vaccinated or have not had the opportunity to be vaccinated.
Okay, Dr. Hancock, here's the question, we have been talking, and discussion has been on Pfizer and Moderna. What about Johnson & Johnson? Haven't heard anything about Johnson & Johnson. So can you explain to us, if those people that got one shot from Johnson & Johnson are just as much as safer than those who got Moderna and Pfizer?
Yeah, that's an excellent question. A lot of people are asking, what is the plan for Johnson & Johnson? And there has been some studies that look potentially for people that are immunocompromised, maybe an additional dose would be beneficial, but really that is also being evaluated by the FDA and CDC folks. And so potentially we may hear at the end of September or a few weeks later on what the guidance is for. There's a large number of individuals that have been vaccinated with Johnson & Johnson that may be looking towards a booster. I do want to emphasize, these discussions about boosters is really about trying to ensure that or reduce transmission, but they're finding that these vaccines appear to have maintained their ability to prevent severe illness, hospitalization, and death. Whether you had one dose of the Johnson & Johnson or you had complete doses of Moderna or Pfizer, that at least and that's the main thing we want. We don't want people to die from COVID, and those vaccines are still performing remarkably well that way. So for those individuals that have just one dose of Johnson & Johnson, I think they can still sleep well at night knowing that they have that good protection against severe illness, hospitalization, and death. But down the road, they too may be asked to get a booster just to really help prevent the chance that you get infected and have mild disease.
Yeah, what I have seen and read on social media, there's no negative comment, in regards to Johnson & Johnson. It's always Pfizer and Moderna. And here we are talking, and we're talking about Moderna and Pfizer instead. And Johnson never mentioned. Maybe for us, like myself, we got one shot of Johnson & Johnson. So I feel good when they don't talk about it and no negative comment about it. So I feel safe, and I'm fine. I'm okay. But when you don't mention anything about it, I'm gonna start worrying. Like maybe it's not working or what? Can you say something nice about Johnson & Johnson?
No, I think Johnson & Johnson certainly is a vaccine that has been used a lot in the islands, and like I said, it appears to have good success at really preventing what we care about most, is that severe illness, hospitalization, and death. And it's nice. It is right now just one shot, and you're finished. But as you mentioned, you see all this data. The vast majority of folks in the U.S. have received an mRNA vaccine, but there's still millions of people that have had the Johnson & Johnson vaccine, and they are looking at those individuals to see that vaccine continues to hold up for them and do well, and it certainly is on the radar of FDA and CDC to make sure that those individuals that have Johnson & Johnson are also having that ability to maintain their immunity or ability to fight COVID-19 going forward.
Thank you, Dr. Hancock. Now I can sleep well tonight.
So tuloy Dr. Hancock.
Okay.
So there are some people that got their first doses in the early days, like February, March, and for one reason or another did not come back for their second dose. So the question is, can they come back now and get their second dose? Even though it's been how many months since their first dose, or if they come in now, would this serve as their first dose and they'll need to get a second dose or third dose thereafter? So those are questions that have come up. So maybe if you can.
Yeah, those are great questions, and ones that I think come up a lot. The good news is if you got your Moderna or Pfizer dose a while back and you've missed your second dose, it's been beyond 6 weeks. All you need to do is come in and get that second dose. You don't need to go and start the cycle over again. Just getting that second dose is really important to help strengthen your body's ability to really fight the Delta variant. So please, yeah, if you got it a month ago, don't worry, you're not necessarily going to have to get 2 in a row or restart. Just come in, get that second dose, get it out of the way, get that extra protection while Delta variant's, trying to sneak into Palau. It's great that you protect yourself. And again, for those of you that maybe aren't vaccinated yet, this is the time to get vaccinated and get those 2 doses, that 2 doses going so that you're protected if and when Delta variant does start sneaking around Palau.
Okay. We're not arguing or debate with you. We just want to repeat what was said to us when we first started this program. When we started this, vaccinated people, we were told that you must get it get the first one, the second one in 21 days. And if you don't do that, you have to go back and repeat the whole process. Is that true?
No, yeah. So the reason why they have the recommendations for 21 days or 28 days, depending on the vaccine that you received, those were the dates that they evaluated in their studies and were found to be, okay, this is the fastest way that we can space the vaccine to get people protected. And if you think about it, when there's a threat of this virus coming, you would like to get your immunity scaled up and get your immune system ready to fight as soon as possible. So that's why they had those 2 dates. They didn't really do a lot of studies to see, okay, can we do it at 8 weeks or can we delay it for 6 months? Because they really wanted to ensure that people have that protection as soon as possible. Right now, the CDC recommendation is, and it has been, that if you miss that second dose for whatever reason, just come back in, and at this time, they're saying all you need is that second dose. You don't need to restart. Now, as you know, we're continually evaluating these vaccines, how they're performing, ensuring that they still are incredibly safe, which they are incredibly safe. But so there may be, as we know, potentially a booster coming up. But at this point, yeah, if you missed your second dose, don't worry. Come in. All is forgiven. Get that second dose as soon as possible, so you have those good antibodies ready to fight Delta variant.
Okay.
Tuligan haling dira kalpay doger ringil wasay wara situation na kwam. Dr. Hancock, maybe you can share a little bit of the current situation on Guam. There's a lot of comments, on Facebook and with the concerns about the hospitalization in Guam being equal parts unvaccinated and vaccinated. So now they're saying, what's the use of getting vaccinated if you're still going to get COVID and you're still going to be in the hospital? I know we've talked about this before, so maybe you can share the current situation on Guam and then the vaccinated versus unvaccinated are currently infected with the Delta variant on Guam.
And let me add on to that question. Is Guam still on a lockdown?
Yeah, so first off, Guam is, they really didn't lock down like before, and that's part of the reason why there's still spread. The governor did try to reduce the exposure of unvaccinated people in restaurants and theaters, because they did find that there was a lot of transmission in unvaccinated individuals, and there are only like 20% of adults are unvaccinated in Guam, so the vast majority of people are vaccinated. So should be able to go into these areas. So it's been, I think, a little bit more difficult to really enforce because it's sort of on an honorary system at this point that people just have to say, yeah, I'm vaccinated. But that's the limitation. The other thing, though, that happened in Guam is they did shut down the schools because they were worried that that kids were getting infected. I think there's a lot of pressure from parents who were scared, and the governor had shut down the schools. Even though there weren't any clusters of infection associated at schools, again, most kids were getting infected from their parents. But nonetheless, it's closed. I think they're working towards finding a safe way to reopen schools. But folks are right. The number of cases in Guam has been going up. There's lots of transmission. And when you look at the numbers of folks in the hospital, it's getting closer. I think it's still a little more unvaccinated than vaccinated. But the key is to really think about what we call the denominator, or the size of that population. 80% of people in Guam are vaccinated. So there's a greater chance that of all of those 80, they have a lower chance of being hospitalized versus that small 20% is making up 50% of the hospitalization. So if the vaccine wasn't working at all, you would see 80% of people hospitalized were vaccinated because it would match the 80% of the community being vaccinated, and 20% of those hospitalized would be unvaccinated. But instead, you're seeing way more unvaccinated. So the vaccines are helping slow transmission, but what we found in Guam is having 80% of your population vaccinated is not enough to stop the spread of this Delta variant. It is highly infectious, way more infectious than other variants. It seeks out people who are unvaccinated and moves through them. So you think about Guam, 20% of the adult population is still 24,000 people that are unvaccinated. That's more than the population of Palau that this virus can get into and infect and spread. And sure, there's some spillover into the vaccinated folks, but really the number of cases in Guam has really been driven by the unvaccinated. The other thing, and I don't have all the specific data on this. This is just discussions with some of the folks who work in the hospitals in Guam, that they're finding that those individuals that are hospitalized and are vaccinated tend to be less sick and tend to be older individuals with comorbidities who may have had weakened immune systems versus young individuals who are vaccinated. It's extremely rare that they're going to the hospital. The unvaccinated folks are across the spectrum from 19 to 80, who are hospitalized. And still, if you look at the deaths, I think Guam now is maybe at 154 deaths. It's only one vaccinated person who's died. All other deaths in Guam are associated with unvaccinated folks. So it does show, one, the importance of getting vaccinated at really preventing, severe hospitalization and death. And then two, the fact that, a lot of the people who are vaccinated who are hospitalized are people who are older, who are immunocompromised, is an important point for Palau to remember. And your Ministry of Health is starting to roll out additional doses for individuals who have weakened immune systems, that their immune systems may not respond well. And so there's going to be an opportunity starting next week. The Ministry of Health and Human Services is will be notifying people who, due to their health conditions, may have weakened immune systems to come in and get vaccinated. And if you feel that you're somebody that, for whatever reason, a health condition and your age and other things, that your immune system is weakened, you can talk with your doctor and see if you meet the criteria and come in and get that additional dose to add that extra layer of protection, especially from what we're seeing from Guam in those hospitalizations.
Okay, according to the report we got last week, I mentioned it to you. There's 2 U.S. territory that has been listed. They've been advised. Tourists have been advised, or the CDC is discouraging people not to go to Puerto Rico and Guam because the situation there is really bad. How is it right now? Is it really bad or getting better or what?
So I think Guam, it's still bad. We went through, just like Palau, went through the 3-day weekend, Labor Day weekend, and as we know, this virus loves to prey on the things that we like to do as humans together, and that's especially, being indoors together with mask off in large crowds. And, holidays are times that people get together, different families get together, and they enjoy together. And I think we may see in Guam, there was some decreased testing over the weekend, but we may see throughout this week some increased cases because of the Labor Day weekend. So they are not out of the woods yet. And I think across the U.S., you'll see that states are seeing increasing numbers. Some of the states that had initial high cases are starting potentially to show a decline, like is showing in Israel and what happened in India. I think you brought that up last week. So maybe we're getting through it. But right now, I do agree. I think if it's not a time to go to Guam for vacation, to hang out with family, there's a lot of COVID-19 in Guam, and you only go there if you have to at this point.
Yeah, Dr. Hancock, we got a call. Can you answer this question? Ali Gabong?
aktif niya ni ko.
Ko mo paigat TV kami usen gol mendihalo nga ko waise.
Oh, aplauso.
Okay. Kapon kera karim.
Tila rin masud jalu iro siya mabugulo rex niya. Ari atul tilkul mo daw ba?
Oy.
Kasi algo grab da blabro da baktulo rusul. Bago na elang esta murió lo hace como para el booster Pfizer. Como bruto el booster Pfizer, el galo no volver a quase. Era muy ideal. Seguir el booster ¿verdad? El bruto seguir el booster Pfizer. Y la galo no volver.
Okay. Kasi return ko ngilu sa question.
Bere hay baila ko kerang kal adra nga barde. Ibay dik ka answer tilal question.
Okay, gabo.
Hindi ka ko dong alwase ibe muwa booster al Pfizer.
That's what I thought.
Dito bakat taklil wase umrusra next week al blal so din kal toktang adia kal booster. Umrusra third dose. Ya kung sa last week kada si Lodi wase ngani akla ka rosra third dose ma booster.
Wase.
Matial bodorus ngina next week third dose. Tial third dose more tirigel adal ngani ya raktir alwal rule 3 matamo immunocompromised lo mitu tabdangirel sel ngay gel tulorus eng dia kalwa adal masisi abdangel sel nga tulorus walo nga song sa sayid del protection ngira gelong ayel tablo lorus gira dal masa selong ya de lorus el musaygi del wal gora protection ngil morbab
Immune system ngil morbab
paisel morbab mang dia kal booster booster morar adal moraro kulat morar masisi el at el wal saygi del overtime malubeng kaltatela time may gal lorus del bangay amral morio ay del walwa protection ngi makatong spare saygi del booster go klamut lo ngas artial lorus mang gira man mo blaktak lo tiang ade kal booster shot third dose ngong ede lorus yal sugum ngila orus sel kot mangeru lorus ra Moderna third dose ra kal bumular niya Moderna mga umrusra next week ati Moderna le ko madangel wase sera ko telomo lara ako telbuy la dorus ako de mirusra Moderna dimla ka dorusra Pfizer el molmutra o ngey melbuila mga ayayid ya I hope ng lo plakatakla angir el morselgere tulig.
Okay. Berngel lugum lang utilang arian mutel.
Ala ka ko tumustawa dawa dagel legel best.
Como ngilo rens mendia de repeat. Alugum ro.
Daria ulbe golbei.
Oi.
Tu dai se ko kwase bom sandiak morogeri.
Oi.
Ako dia sabele dum muster agra.
IOC
leta moria toxotira. Ahora lureo.
Makalame.
Tiagi galun bodol be kwase. Maria Rodriguez blara brigera se tara sante blay.
Oi.
Tialdi no brek sante.
Oi.
Ela gaidu boda kwase. Tiga gojira uluai se kwase agi blabe bla test.
Oi.
Agi degesti.
Oi.
Tulger tilwa se bilgara obolara test. Esta kwase aquí por se reporte tuvimos como vaya ayudarle what el día vamos al por escape para el street okay yo voy a negativo bram el así seguite ya dulce abruría lut tagi lo sabi tia quase distrito gua
Tadingi lo swap ngul mistri asem turor tolle mergom swap ngul me
algo trabi gal podre buka sia yo le quase sia bras se tele te no sagri bruri
okay kim lang wa question kom lang userite o sen ditir sel gerda passenger tu wa swap ngum sanga gal q-tip sanga rampel mergot et ngul tungira ngiri ngisngire ngul mistri da hospital sen wa sei
ang waise tulik so yegi de lomra el ngara kwamel may trigel motestra airport ngani yegi del yel test del dulsa del wasing binax antigen testing yegi da lo spera airport ya ada self swabber ni maluben dingil ngwa aga gidle q-tips ngulo yera isngele ngwa asampol ngarnyar adra lab mar nurs mar adra hospital ngarsay lo Dr. Hancock, Malsibel Mutal Smoding Malubeng Gagidale, Dr. Cash.
Okay.
So, Dr. Hancock, they're asking about the self-swabbing procedures at the airport, and they're asking why the nurses aren't doing it and why people are self-swabbing. So, if you can...
Amo di ka question na ka ngel lu.
Ibol ko din. Sabi ko sa kaya.
O han the return sa del mutel last question na ngel lu lege question na ade to in call eh.
Arbo.
Okay, kabong.
Elak kaya ibol ko kasi. Algo bravo del was it la advice is CDC.
Why say?
Elang ngaria or elang benar kuasa ya. Ngaria flight gara huri pige benar benar cara palai wis belu. Oh COVID lagi. Ngaria flight benar 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 but open the flight benar benar.
Kahal ngal lu tilang mo ka beringi on grile return dia.
Kahal el finish ra kanile.
Okay. Kabong ngal lu.
Algo tabla advice tira CDC. Elak ngaria go flight bolo pela flight berbelo rahuri pig elak to ga del wasi kul gora ala CDC gira say the flight
Charter flight.
or ga rahuri pig berbelo su mori
Oy.
say the gora
Another was a question was segom ngilo clearance the CDC allowed say the Malaysian Air Mirat this September 12 return.
okay say it
Oy. Okay.
Tulik haldi dam kataklil wasay kita ta kato latur kara CDC kongias kogil mesoy sa berbelaw.
Okay.
Oy. So as kogi charter flight tamera September 12. Oy sige dal ngara huriping al mel.
Oy.
El mutel mura huriping.
Say the regular flight and charter.
Charter clothing era masing charter flight al ngara huriping al mera 12 el mutel mahuriping.
Oy. Okay. Mister ilang dia dola ya turgara CDC WHO mal ubengi dilat senga authority do bang other belau mangkida se okay pem tu etmet mo wase.
I say. Kultura igal directive brigade ma aro pel protocol el bladru la
And we provided that the motrura gigi the procedure like 72 hours prior to departure. Obviously, the head card tiralme they go through the same process. The diwaya the treat passengers ang araguaman may. I say. Okay. Gadol mo.
I'll go back to the question, Dr. Hancock, about the self-swab at the airport. Maybe assure the public about the.
All right. It's a good question. So these Binax tests that we're using at the airport are a newer testing technology than the original test that required what we call a nasopharyngeal swab, and that's that swab that people may have seen and actually gone through, where the swab goes along the bottom of your nose all the way back to the very, very back of your throat. It's not fun to go through, and because of that difficulty specimen collection, it requires somebody who's been trained how to do that collection. And so thus a nurse or a healthcare provider would do that collection. These test kits are designed to do what we call a nasal swab, which is just the front part of the nose. It doesn't require the swab to go all the way back.
Oh, okay.
And so the test is designed for that. And they have found in the U.S. more and more self-swabs are the way that people are being tested, because they found that, one, it's much safer for the individual who's doing the test. They don't have to actually get up close and grab the person's head and put a swab down their nose. Instead, the individual who's being tested can do it. It's more comfortable for the person who's doing the swabbing, because they have the ability to sort of adjust the swab to where it's comfortable, rather than just having someone push in until you can't push the swab anymore. And so they actually find that people do a better job of getting the swab farther up into the nasal passage and swab. And then last, for airport testing, really wanted to ensure that passengers are able to move through that system quickly. And so the nasal swab, while it's safer for individuals, you get a better sample, it's also faster. And so the passengers can swab themselves. And again, these tests are made for those nasal testing. And so they can swab themselves and move on, and it really helps us be able to test those people quickly as they move through the airport.
That makes sense.
Yeah, and we think we agree. I mean, I personally, I think it makes sense, because otherwise, if you can't get people processed quickly in a safe way at the airport, then you have to look at, all right, do they come into the hospital the next day, and do we have them line up? And there may be somebody that's positive coming off the plane who has now spent the night in Palau, maybe with family members, or who knows, waiting. So that's why we felt if we can get a quick, efficient system going at the airport, that's going to be good for Palau. And really, your Ministry of Health and Human Services team was just outstanding in making that quick adoption of that process. They adapted, and I think it's hopefully going to help reduce the risk for all of Palau.
Yeah, even the health and caretakers of these people that coming off the flight, they don't have to be that close to them, where this is a highly contagious disease, So I agree with you in the sense that we keep try to protect the health personnel, not to be that close. That way we reduce a chance of getting sick of COVID-19. So that makes sense, really. Okay, let's get this next call. Ali ungil gusto ngay?
Ay, malungil gusto ngay tulik.
Oy.
Sa lugar geril mortira al totang, geril ngal mutation ngal varianta. El mulwasing ngal varianta wayal baby, wayal offspring ngal original coronavirus. Kura objektif wasing ngal geril varianta mal uyul. Ngal original coronavirus. Adita rolling so isu belaw al suwong ngal original COVID-19 amir belaw en su el mutant su el change at change ni makomosom serni emo inherita ngalget en spread ni al ser belaw kamura ko oria total masing kora wang prevention ng kaji del mal buyuyuk.
The variant, yeah, I say.
Oh,
okay. Sula. Comme you say, Rite.
I said to so Dr. Hancock, that's a question from the caller. So their understanding is that the Delta variant is like an offspring of the original strain of COVID-19. Yeah. So they're asking what are the preventive measures that we need to apply in order to stop transmission of this highly contagious variant.
Oh, great question, and I'm glad someone asked that. So this variant, while it's much more infectious, and we find that it's able to, when you get exposed to the virus, it's a bit easier to sort of latch onto your cells and reproduce in your body and create more virus that then spills out and can infect other people. But it looks like it does transmit the same way as all the other variants of SARS-CoV-2, the name of the virus that causes COVID-19. And what the primary way that it spreads is really when you're within 6 feet of someone and you're talking or you're singing or yelling or sneezing or coughing, and those drops that come out of your mouth land on that person, can land in their eye, can land by their mouth, and then it gets into their mouth or they breathe it in, and they can get COVID-19. So that's the first thing, is really trying to stay away, at least 6 feet away from individuals. The other thing we found is that some of this virus can get into very small particles when you talk or cough or sneeze and float in the air a bit. And so you may have seen recently more and more there's an emphasis on good ventilation. We find that if there's good ventilation, people are outdoors, there's wind, it's very difficult for those small particles of virus to find someone to infect. But if you're indoors with a group of people and you're eating or talking and laughing and you're all indoors, that virus can float up in the air and spread farther than 6 feet. So over and over, that's why, restaurants are high-risk areas, bars, indoor bars, and as much as possible, I think really trying to do things outdoors where there's good ventilation is important. Then lastly, washing hands are important as well. That general hygiene is important as well.
Okay, thank you. Okay, Kadal one Ritesh.
So lang itulig kuk dasing ko di tama di maran mo by the kuk bastrat al trigal teruru ba ko bangget. Kalau kora mo meskit sel kuk kora aulaklat kalgire lagi dilgire del mokra.
Okay. Don't worry about the time. We can extend it.
Sulat tulik, pati artiang ma overdeu, agi lumiting NEC LA, Vice President ma IC, at mula sebem hukum ter NEC, mdu bebira kora umil ulaklat.
Oi.
Kadra blue kumsawrak te al.
Okay.
Amal global gule Mr. Diasa, atkal virus amoluli mengimul, almer belau, adi gidel ab. نجد الأذى موقول قد ممترقاق لذا قدول تلاق فايقال البلال بسكيدة أوسبيتال جيد لابنور بلاو جيد مسار تقال التال راقت اللي مول دي قلت له قول نسوال المو كلوان وود الواسيت تال بروتوكول براسيس البلال قد لابنور بلاو لو أوسبيتال جيد را ايربورت أو ريور from step 1 المور alást جاجيد من سويس باقوبيد تمستيقر ني preventer ngi mendiakal yul ngo rior amo ul mungi mularak atarga kles agidar at
masay
unselo subgid hospital kulger wasegi melmol meloreng sergamim oy ko melmol meloreng sergamam mo diakal yul arak maslo belgul abol kid rogul other bela bod madal dil gid el momdal amo ula garbil tiarak melakal yul ma ontila Vice President Udu Sangbao Senior, niya Chairman NEC, maalang lil NEC. Ugardewa, swadlo ay sulwa si Bodo Madal Tial, Garbil, COVID-19. Sum komestri al adel modern tri al adra blimiul gileder selskogi, mo messer film lol tirak la vek ul a order surtira a belgerda. يقمم الرجول أدرى EOC الكميد المرة ويم الأرض. أمو مدلا أريتر الألمون. يجينا الفايس بريسيدنت ودو الواسين أجي مستري الأرض المرة يقال باسيو لغلو تيرك لا يجي مسودرا EOC EOC مسودرا بلا بوليس. نجينا الأرض المم أسيمر. لين تيجي دا سوق الدولية اللي بنقول أوردو مع NEC. Al sumum me sois parakter belau, mal dak poktul wase correct me if I'm wrong, lek madengel wase correct. Al sis ba gobider belau en dak logol delta virus. Gagi da doctor ten hankar at mo se delta virus ay misil contagious. Bodol aswar segid التقوي. bodol aswar wase kadungul mo owner ngil wase gida ganiyang ledra be kel sis el mogolgik kel gilel karakt. المغرقيك لورينسو سنجوك مراس تدلا EOC الواسم لارنيا باسيتيف المسؤوليس إذا قدر رئيس هذا إمول بلول بارت كتير مغضو إلى تريل بتمك لعمر قليل إمو سوديد رح كلمران ونيل كلمرال عايش كلمرال سود إذا قاعد يسوى الدولي يا أبوك بيسجد الحمد لله كلا قرنيل واسد كيال فايتر هوري فين أبو ذب إيري أدلو مرا أرني ملو مرا أرني أبراسيس أو ريور a proceso urior ndi mo ngal ali yang askogi ma location ra bel department askogi ma a aircraft a diabol positive ter adal ngal al sela mo positive so no matter where it comes from ntiagi del process el ma protocol blado a plar ni tel blur belaura ra border sergidra entry gid longot mo kanya other hospital tiagida adul turni evolo clormud et to remind ourselves of seguir tel blur belau amla open kodo rior amla open bang overdeu malgania mal sum sub el fukti
so in other words asum atol malgoni amla se kerdi mo kergik la de emrengi da eral tu kita sa tayo kung wasi.
wasi di ka kalmata COVID la blul alle dia
ay
kita mla open
wasi
solang malungil ka pasange tulig el mergaw maradam rogui
okay
tapi mo mangarawak lagi kita baldunga ulgri lo sa aking atiang al madala MEC el milisi aurela IC riter matira el gafar merenga sulit tegal terul toktang maradara Ministry of Health and Social Services regid raurol blalgat makli mla motrui el buil motrui etiul buira magamadil tial tingela covid seguida blaldelia ulgril kada marail ragamang lo marail nami seguida blamdelia tuligel wasia alak langara kril egegida igel nilo el mei esel al meng unkelt mokul tial magamadil tial rak el mesois berbelau magada salva aqlending seguida blaldelia ulgril wasia bodebek la adel ngrel eta madad الجيل شوفا كلي تيال بالواد ملول مول ملوايسيل سلب عقل المرايل بدول مداد لين يجي كده نعمدون التقوي مسويس وهذا يقل دونو تعذا والمسي سبي
اوكي يو قلت يو قال تقول تيال كويستشن التاني قرقت تيال كويستشن اوكي كولر قد نغرا لاين
Oy,
كابو كير
malung itu tahu yang sengil korga bias kau ma, ada CDC ma, ada toktang ma, rural hospital ma, laktot tulay ma.
اوكي NEC
Jadi ager,
اوي
lehor eran khusus. Ager wasing, naga malo mesetiar kita COVID-19 na TB. Ini sa Obama na 2004 lehor telah adal metro belum law tiayil COVID-19. El wasing Alsela Fabis Rat, yang amornya arak short story era alsil sekarang alsil.
Alsil.
Bila dalam suri kerja, anggil Bill Gates singgil waktu merau ada involved kerja, mengkai juga anti vaksin involved kerja. Tidak masih demokrat ada Amerika. Agar demokrat tok tengah soal ogestil wasi. Kami kom demokrat, kom republikan. Oi, usulang.
Okay, there you go. I love politics. Kabo Dr. Tele. Wow, titules rengi.
Awai gidel gera mal melut kara ulul riter ma kafar. Di bok sab kaltrir. Gidel adar bela ngatiang NEC ngatiang. Gidel ogul adar bela madala magamadila mesoi seberbela.
Ngai.
Dia kalio ro sing rangklel politics sa Amerika la tangara alsil. Le ama dia kado ya ka ulao edbe de sis sebra alsil tiang. يجيد الدرستام درستال تقول سب إذا الجود مقل إن سلب أقرأ يقال لما مريك التري ما إتول بوي ديال بيوت التقوى أبلو أبلو غايم إتول باسن أراد ما أوروش كتير
دي بتبتكلي الواسي جدا دي هذا نرتيال مساعدة politics التراك تقدر نرتيال مساعدة prevention how can we survive
ويسه تولي كمان مساول mal ungilar muksel omdelit til agid legat tungklum el mortrigele del dar tal adl wase kame boda dungutel orsud tigalo gaim etul basen tra adr belaw na mongutel orus al abiagal elwif al sugum mornya tiasugo yuru rakt mamngita lemenga agid angal toktang al bladr ngasilo ase ndirek limur tirgel langma orus ndiagal sal mosme el way tirgel dirgal nga orus el mo erura kodal segida awal kelme edel mere algo besengi magi ngati al maldi mangarok lagi el lamdu olingi tra radar belaw nar umra el mei el albla bem ger del mera blu ndi al is ti al blu motirak lagi la al laptop da i o sirgid e mo spert ti al de ngwale sira irar mo omega da sen songo bel lo meser gmiu ndi ga do esa madamiu el adi ma mo de ngwal mem do esa madamiu di ili mo mrega atemiu ge emergo
amedo ko ti ali mora gore e koler dingan alain
Oh iya, maluin ko saya pirga.
Kabo.
Pirga masya ilale doktor han kakal bukan siya. Malu kita ni say. Awai lo gol wasem. Gan hal.
Oy, sel du era mo ko mo fa lagi de kulangan el TV ma radio. Kabo.
Pirga masya doktor han kakal malgol wase ngora walol ko pay omran morakwam oy mungil di Bela, aku kamera ngar kamel mer bela amkarang. Sen suweden dia kalbo ndi abla kama sil mer bela. Tegila taragir.
Okay, good question.
Ela tegila kamento gire ngarinya. Dirigel makasal population gira nga orus. Adire gal ko na mamda su lo setiwa gal ko experiment ra gira agra ya. Tial bela ul COVID free. Melo lorel murusur gida bol lo las melo lo warak sen mer bela la sen sob el lo gida lu ndi akas la gida mo fir mo regular adel ra ndi maim la mo complicated like rogu el action el ko ngar mo de ko mes a liver ser gida mru el mo ngeme seguida adire gal gida ramra suri
okay alol gorngia doctor telea se adra tigahalero rutian ruli del mowakini pike el wase ngaria wase tel kota temnesta tergide o mesergide observergide no el mutia oror man open dia seguida tara question seli mura question a plagu besergi no sengun mogral question over de gurin sei
tulegan semle hotel gari la kolera girela tingin la ang katoktang lo sa time CDC o kabayra adam dia kalbora ko Puerto Rico hindi gari la sa ako kadal merbela ngara kwam sa dal makataklil wa sa igel sel directive al time mal blaqtak lo sa adal me giren la marus rogul adal mail ngarba barkira 12 giren la marus ngua test ra edel clubsera within at ito klubsera ang asas ko ginmay. Sa lamay kada test at tiri airport. Taygi del blol manekal smoothie over there ma olgari lol ngitra adra blul sa ta kay ngaselo maklat ket tirgay del albebiri gidel may lo sa ko mo tirak lay gidel el gimol ngitra kamiu lo sa ko mga sada la bisira at sa blu di kera gel ngaringi kablimiu o mask de kapom gedra ngal daliga kalorus el ayim klubse mengungel logerul test ra a hospital ay gidra ta mado marang alwaseng ngaringil masabah krigid al sugo marak tami igitten na mesa tulig ro se trigel terul positive amlamo erul sunday ra lalme madang lamo direct amlamo ngara erul dart madringil atami since ra trigay gidil terung amadang still ndirga kal mugtal bes el gays el madang of course kada mesra kada malmon malo mesra situation ra kwa ma direct kabir ra marigel al sugum gyom das lo sing namo gide del guk ngoto iya process kada guk modo dura officer president ma in isil lo sa kame do mesra telo sa makara guk tore ringin mo sa ba akrigide mong kada malmon lo ba sa gide process o mesra ringin mong il time sabi ira adal nga rakwam el may hindi giri lo tirak lay gigit el blato turco closing teletele la protocol ra amesoy se revela nga akwam lu model belu se long erul gere tulika oy maral ang anyar bebi ra adal gora morar ndi om da society aglel gora experiment nga raktel ndi gitelo mesa news tel rakta dia oy ngaringil rak dalam kuadra adra ikel belaw taqdal aqwa talgib talgida qamata landiya qad sarab alwat landiya qad saring lama qodal sarab alwat alwa wa blu raqwam hawai mamrigel maqdal aqwa morar rarungud lo singara maqdu mal qura ngatiang mimok kulmuru legel swad almru eniyat do mesa news ngora wal tingi ma do mesra qatsudol qura mal kloaring lama غودال رايكل بلاوندين صاد السلبا اقل اول من اقوندس امسين درا ادم لمن اوروسا عمر لوسين مران غني ابو القول عمر تقول مران ميترق تاخذ سلبا اقل را غودال ما
سيدر ما وان موركو اوكي علي كولر غير غاتيلا
اوي اقنع
اوي كابو
tulik kau ma doktor watri ko mga farm to ang doktor ya ka ba la pix ay ga na issue na migel al bang al omes pagkal bela ay ga hidden open ra si le close was this ma NEC ay ga kami na wala ka ba dito may ga pala pix ang subit plus ang ga pala pix ay ga
Gilog small ay gajil mo kamo ngay. Jaman niya gilog do gen nila toktang small mo kamo ngay. Komsulang.
Ay. Kabong. Kang hanya insera han senti bote kafar ka ametse.
Kaya kang mal masawla ko lere, mal marat to ko sel boda kalakal lo mes away gigi kada mangan mo chlora ring ra adra bulul se ga kalel quradi kalel quradi kloko el politicians marmara al adra igal maklol bulua o speringil qura o bigit lo mong may mong.
I see.
Akda understand ra concern ra ko lere, I'm sure in atakal din ngilta. Hindi kumda se tulig hindi akal gida dalom ko siurgi da may gagi din maklol bulu.
I see.
Especially to kora politics.
I see.
Kato mes ringi ngora mo klobulung sel bal mo do bal mo lelak lom tabaringi lo segal mo klol bulua. Takakawat al gida la angrak ke lama mo dan ngara malgeda kara ngaret.
Oy.
Maram tamlamor sa gida point tamlamo o makamadal ma.
Oy.
Pag titakang gira lama matal topan mirang ari gida ngat tangat tiling la klas yoga ngari gida matetele da kuktiak da sal mor sa gida mo o mondara ko ramal gigrit to koy mo kada understand ra ko ler ndi a gumda swing gira del mo timo korgik le mo o klorungu de o mi atoil mo sel la terigi de mor ko mo accept terigi mal
kafar kamiu sel go meser kamiu kamiu a provet ya Cristiano ko mara Biblia. Ya Biblia lo aruba kan la ga king la aruba kan ngara Biblia. Mengdi wasel do el mulla sei. Imol maasen L'Oreal Bravo misel mas mora ave me helicopter me laringi embergoen en tin bong mas emroasak mengi aruba embergo agora pol L'Oreal en mail ben mogotir mora papel WhatsApp se ngara mengi aruba ka de ko me ase sel helicopter el black center ngi le gong senga oy magmiu abrobet lo dru lo ndara expert mengiram do reng sengaga adigi arura ngokla sa ko marat ngela Dios le ngaga Cristiano ndia question atingela Dios metirgal adan burta galu rora meltut kra Dios el momru ngim expert magugululu urgid lo sebos ved guk at least do rengs protect yourself men lakam contaminate society dengan alsel ma community transmission adia al stat que el belu men sef edel matara mal di grebel ta men medi pa di tolngit lo se pot sef edel lo rengs ay gagid instructions ma scientific facts lo lablo mskit ya gadi hat tigingira waqafar tigingira melom sel ngar serba be durok men mergit me please bom nga orsmi wasugum dirga complete tra shatter ka okay coming a kafar
kamsulang tulik aware atong simira kumda sa toktangal angani ako ra tublot tokol saldi mo
nelgo hoy.
Oh, thanks. Yeah, thanks, Mr. Diaz. Just, you know me, my apologies. When I get going, I have a lot of things I want to say, so I appreciate you moving me along. But I wanted to re-emphasize for our community in Palau that although I really encourage everyone to get vaccinated, I also want people to really be aware of that additional treatment that's available for folks on Palau. If you do wind up getting COVID-19, or if you're exposed to somebody and you're for whatever reason not vaccinated and you're somebody that's high risk for being hospitalized, there are those, we call them monoclonal antibodies. The other name for the medicine that's here is called REGEN-COV. And again, it's been provided by the U.S. government to Palau, and this medicine really helps reduce the chance that you wind up having severe COVID-19 and going into the hospital. And so the important thing is you need to get it early. So once you start having symptoms, and if you're somebody who's high risk, who's older, somebody with diabetes, somebody who's maybe carrying a bit more weight than they should, if they're obese, those sort of things, be ready that if you do unfortunately get COVID-19, that this is available for you, and you have to come in early to get it. So please, if folks that are listening, remember about this REGEN-COV, this therapy that's available early for individuals who test positive, who are high risk. Spread the news. Think about it for your parents and grandparents if they do get it. It's just another tool that we can do to help fight COVID-19 in Palau.
Okay. Ya bon musu bugo kafar.
Okay. Thank you, Dr. Hancock and Dr. Cash, once again for joining us. Sulang ukodeo kama ulgoril, lugok madala NEC me mangali me patakay nga sir tial ubelet magiman penga sulit direct. Ang adimos timor segi de tulik at sumal digiage de Kamring asulir bekta, gimring asulem adara ngarel belaw.
Okay.
Makuk next talk show gid.
Okay. May igang ma next Thursday.
Wala.